You're listening to Online Pet Health Podcasts with Dr. Megan Kelly. Continuing education for veterinarian rehabilitation therapists. Learn more at onlinepethealth.com.
Hey Vet Rehabbers, if this is the first time you're listening to the Veterinary Rehabilitation Podcast, welcome and thank you for taking the time to listen. Please click the subscribe button so you get notified every Wednesday when we release the next podcast. To my long-time listeners, thank you for your continued support. I appreciate each and every one of you. Now, I'd really love to connect with you on Instagram, so please take a screenshot of this podcast, post it on Instagram, and tag me at Onlinepethealth, and let's get connected. It's so great hearing from you and knowing that you are joining me each week and listening to the Veterinary Rehabilitation Podcast. So here's a big shout out to Sam from @VeterinaryNurseCareers. Thank you, Sam, for sharing your story. I'd love to gift you a limited edition Veterinary Rehabilitation Podcast mug. Please email me on meg@onlinepethealth.com and I will get it to you straight away. If you're looking for some online learning to do, we've just updated our webinars in our free membership. They are in the small animal membership, Mind Body Exercise for Dogs. What is the role of canine cognition in therapeutic exercise? This is a great lectured by Ansi van der Walt. And we now have 171 hours of vet rehab specific small animal learning in our small animal membership. In the equine membership, the free webinar is Returning the Equine Athlete to Work After Injury, and this is lectured by Lee Clark. In the equine membership, we have 106 hours of equine-specific vet rehab training. On our hydrotherapy membership, free webinar is What's New in Hydrotherapy Research. This one is really great, guys. It's lectured by Arielle Pechette Markley. And we have 82 hours now of hydro-specific training in the hydrotherapy membership. If you want to be able to access these, you can sign up at onlinepethealth.com/free. So that's onlinepethealth.com/free. This week I actually speak to Arielle and we're talking about research, but this time in sporting dogs. Arielle has such a passion for research and specifically in this topic, and you're really going to hear all that passion shine through. So over to Arielle. Hey Arielle, thank you so much for joining me.
Yeah, thanks for having me.
Arielle, I'm so excited to talk to you about this topic, and I know that you're excited because this is a topic that you're really passionate about. So can you tell us a little bit about yourself and how you got involved in research in sporting dogs?
I'm Arielle Pechette Markley, and I'm currently a sports medicine and rehab vet at The Ohio State University in the US. How I got into sporting dog research was kind of a long, circuitous route. I've always really liked research. I did cancer immunology research when I was in undergrad and vet school, and I really liked being able to kind of push the boundaries of knowledge and kind of, make new discoveries and learn new things every day. But I never really found kind of my passion point when I was in school. And so when I graduated, I actually did a year in emergency and then 5 years in general practice before kind of discovering the rehab side of things and going back and doing all of my rehab and sports medicine training. And it kind of tied into, I do like running and cycling events. And so there's so much knowledge in the human sports medicine field. And when I was doing, my long distance training, there's very defined kind of training regimens. You build for a few weeks, then you back off. You build for a few weeks and you back off. And, these kind of periodization methods. So you've got kind of a base training session, and then you have these different kind of blocks throughout the year. And when I moved into doing canine sports medicine, my clients would ask me all of these questions like, how should we train for this? Or what's the appropriate age to start this? Or how does surface affect this? And there's no research, none. And so I was always like, I don't know, like we don't have the information. And so then you try to take stuff from the human sports medicine field or from equine sports medicine and apply it to dogs. And maybe it's accurate, maybe it's not. And so that kind of pushed me into trying to solve some of these problems and answer some of these questions.
So I don't know if you know this, but I've actually termed you in the Vet Rehab Award the Queen of Research. And the reason I did that was because There was a Facebook post and somebody asked a question like, where do you get all the research from? And like, so people were saying like from ResearchGate, from PubMed, and like a whole lot of places. And then you like said something like, well, I've actually like made my own, like I've got about 1,200 research articles. And then I think I commented, I said, well, we can just ask Arielle. So we don't have to ask PubMed, just ask Arielle what the research is. So that's quite amazing. So like you've obviously like looked at all the research, and like how have you got that whole system? Like where is it all, in like a Trello board, or how have you saved all those research articles?
It's in folders. And so it's still a work in progress. So I'm also doing my ACVSMR residency. And so kind of in preparation for the board exams, I've been collecting articles that are, relevant to study for boards. And so I have the like folders for each of the journals that's, has articles that are relevant, and then them split out by volume, and then they're tagged with topics. So it's still a work in progress. I actually downloaded a program. It's called like Devon something or another, that allows me to tag things and link things. And so yes, it's still a work in progress, but I can usually find things.
Yeah, because that's a lot of articles, 1,200.
I think I'm over 2,000 now.
No, oh wow. You're doing more work. I can see lots of studying for your boards. When are your boards?
February.
Okay, so yeah, lots of work happening. So if we look at the literature that's available in sporting dogs at the moment, where are the biggest gaps?
Oh gosh, it's basically all a gap. The studies that we have some in agility dogs with, so I guess we have to take out, like, there's a lot of research in racing greyhounds, and then quite a bit in sled dogs. So like the long distance endurance sledding events. But that kind of companion dog sporting, research is really, really limited. So in agility dogs, we have some retrospective studies on injuries and training, and we've got some biomechanics studies. And then in flyball, we've got a couple of studies, like retrospective survey type studies on injuries. There's one retrospective injury study on canicross, but basically like the rest of it is just a gap that we don't have anything. And so even within like the agility dog research, where there's technically more research, it's basically all retrospective. And so we have no prospective studies on any of the sporting dog topics when you take out the sled dog and racing greyhound topics.
Yeah. And why do you think the racing ground and sled research, there's more of that? I mean, is that being sponsored?
The racing greyhound, I think because there was a lot of money in the actual, betting and sport itself. Plus, there were a lot of concerns about the welfare of the dogs, which is why, a lot of places there isn't racing greyhound, tracks anymore. And so I think welfare and money was a big component of that. The sled dogs, I'm not sure why that particular sport, whether it was, access or the people that were doing the research. Mm-hmm. I mean, I guess that also there's endurance events themselves are a whole different ball game than, the companion sports. I mean, those dogs are running, hundreds, thousands of miles. So the physical capabilities for those dogs is significant.
And so what research are you involved in at the moment?
So my primary focus is agility dog research. So we've done quite a bit of like retrospective survey research, basically just to give us an update on the field and give us a start for like future prospective studies. One of the biggest issues with any research in any field is funding. You have to have money to do research, and there's not a lot of funding when it comes to sporting dog research. Tons of money for cancer research, obviously, which is a super important area, but there are, a lot of fields that are significantly underfunded, and there's not a lot of money in sporting dog research as opposed to like equine sports medicine research. Those horses are worth millions of dollars. The racing brings people millions of dollars. And so there's a lot more money in, racing thoroughbreds than there is in agility dogs. And so I think that, funding is a big limitation. And when applying, one of the catch-22s for research in general is that you have to have some research in order to apply for grants, because if you have zero research, then the grant reviewers are like, well, we don't know this is actually an important topic. There's no research, so we're not going to fund you. But you have to have money to do research. And so that's why there's a lot of retrospective survey research out there, is because it doesn't really require funding to get started. And then once you have that retrospective survey data, then you can use those results to argue for funding from grant organizations. And so that's the kind of where we are currently with our research. Is we've done a bunch of retrospective survey collection, and we're still publishing some of that research, and we're using that data to apply for grants. So we have a study that got funded to do like biomechanics of weave poles. And then we submitted a couple more grants recently to do more prospective, like training, data collection, and like wearable activity type monitoring.
And is there quite a lot of research in the equine world in those topics? I mean, obviously not weave poles, but wearable.
Right.
Yeah.
That is starting. There was actually a paper that was published recently about using like accelerometer type data in equine, like sports medicine, but it's not, obviously the size of the horse, I think, is somewhat of a limitation for some of that type of data collection. I don't stay quite as up to date on all of the equine literature. I typically kind of pick up topics that are obviously relevant, but even the training load type data there's not a lot in the equine field with regards to like periodization type things like we have in human sports medicine literature. But I think that that's something that's also being looked at.
And if you look at, sporting dogs as a study population, what are the challenges that you have, and what are the benefits that you have of that population getting information?
Yeah. I mean, I think that one of the biggest limitations is just the funding to do the research. And then also, depending on what sport you're looking at, just all of the variables of the sport. And so sports like flyball are a little bit easier to study, or would be. I mean, there really isn't a whole lot of there is no prospective research in flyball either, but that sport, things like fast cat, where they're just running after something, is a little bit easier to study just because there are very few variables involved. It's always done the same way. Whereas agility, which obviously is my area of research, there's so many variables because each course is different. And so the dogs aren't running the same course every time. So, the approaches to the jumps and the obstacles is going to be different. There's a lot of different surfaces that dogs compete on, lots of different breeds and body types. And so, I think that makes studying that population of dogs more challenging than, say, like racing greyhounds, where they're all the same breed. They all run the track the same direction. That's there are a lot fewer variables when you look at that population.
And obviously the agility, you also have different handlers. So that obviously also changes things.
Right. And that's going to be one of the biggest challenges, I think, doing research going forward, is that, it's not just the dog. You have that handler involvement. So how much does that, the handling skill and the timing of cues and the handling methods affect the dog, which could affect, biomechanics and injuries and all of that. And that's going to be something that's going to be really hard to piece out, but I think will be really important going forward.
So most of the studies that have been done now are a lot of them surveys.
Mm-hmm.
Yeah. So surveying the people that are in agility now, because I've seen a lot of those studies.
Mm-hmm.
What do we know so far from that research and those surveys that have been done?
So there were a couple of there was a survey done by Cullen back in like 2009 that looked at injury rates and kind of most commonly injured body locations. And so they found that the injury rate was about like 32%, and that, like shoulders, back were most commonly injured. And then we updated a survey a couple of years ago. We found that, close to 42% of dogs had experienced injury, that shoulder, like low back, iliopsoas were most commonly injured. And then we asked a bunch more questions besides just kind of the injury locations. We asked questions about, the ages at different, that people started different training, how different obstacles were trained, how often they're training and competing, and tried to kind of correlate some of that with injury. And, it's hard because it is retrospective. So there are a lot of limitations. So, correlation does not equal causation. And so I tend to be very cautious on the conclusions that we can make from the current data that we have from the retrospective surveys, just because of the limitations. So we can say that there are correlations between different things, but I think a lot of people then try to take it further and be like, oh, well, like this causes this. And that isn't necessarily the case. Could it be? Sure. But, the survey that Dr. Deb Sellen did on cruciate injuries got a lot of, it went around Facebook a bunch, and there was a lot of controversy around it because some people tried to simplify the results, and you put together kind of a infographic that oversimplifies kind of these survey results, and it makes it sound like there are these obvious conclusions with regards to, like, dogs that run more advanced courses have a decreased risk of cruciate injury, or dogs that compete in flyball have a higher risk of cruciate injury. And so then people all got up, overly excited about it. And they're like, oh my gosh, like, should we be doing flyball and agility together? Like, oh my gosh, my dog's going to end up with a cruciate tear. And, I think that that's one, oversimplifying, and then, taking the conclusions a little bit further than what the data actually, shows. And so I think that that's one of the risks with the survey data, is that people tend to take it, they don't take the limitations into account, or they say, oh, there are all of these limitations, the data means nothing, and they just throw the baby out with the bathwater, and they're like, surveys are worthless, like you shouldn't do surveys, they don't tell us anything. And I think that also isn't fair, because we have to have some data to start the future research with. And so I think that the surveys play a role, like they have a role in research, but we shouldn't be making, hard and fast conclusions from the data.
Yeah, I mean, and also one of the things is that, the survey is from the owner, right? The agility dog owner that did it. So they would have had to have known that that condition was diagnosed. And so how many conditions are undiagnosed? So how many agility owners have dogs? And I think especially with those really like subtle injuries that maybe the owner is not aware of, or the vet that is treating them is not aware of. So like if they haven't actually been referred to a sports medicine, like vet rehab specialist, vets don't often know about some of the subtle injuries, like iliopsoas injuries, which I'm just thinking off the top of my head, and those like subtle lamenesses,
bicep tendon injuries, and
that might just be undiagnosed actually. So so there are lots of limitations, and obviously then all the variables that we discussed. Those are all the things that we got to think of. So like for those vet rehabbers that are just getting into sports medicine, and I think for myself, when I first started treating agility dogs, and that was back in like 2007, and agility is really like grown as a sport internationally, and I think definitely in South Africa. And I think agility pet owners have also become so much more aware over the years now of, the need to maintain their pets, the need to be quick to have a look at if their dog has a lameness or there is a problem, that it needs to be diagnosed and treated, because if they don't, it can turn into something chronic. So I think back to my day when I was treating cases, I only had maybe like 2 or 3 a month. And I also wasn't that aware of the different types of sports. Like I knew of them, but when those subtle injuries came in, it was hard for me. So any advice that you could give those vet rehabbers that are just new to sports medicine, so maybe that are not seeing that many patients?
Yeah, I think that, obviously there are a lot of different sports, and I certainly don't claim to be an expert at all of them, because there are certain, populations of dogs that I just don't see. And so I think, identifying what sports your patients participate in, and then, the way that I started out, once I started seeing agility dogs, I started watching a lot of videos. And so, trying to figure out, what does that sport entail? Like what, physical demands are there on the dogs for that sport? And then trying to find research, which, obviously for a lot of sports doesn't even exist. And so, the companion sports range from, obviously there's agility, which is, a very big population of dogs, but there's, dock diving and fast cat and, the pulling sports and the protection based sports and, the obviously, sled type sports. And so each patient population is going to vary in what you see. And so trying to get as familiar with those sports as possible by, watching events, either, plenty of YouTube videos these days, but also attending events and, watching how the dogs move and, what's involved with the training and the competitions. And then trying to, look at, because we do, at least in agility, have some research on biomechanics. And so, looking at the actual, biomechanics and forces on the body, and then also looking for any studies on injuries, which obviously we do have in agility. So we at least know kind of what the most common injuries are in agility dogs. And same with flyball, we know what kind of injuries are most common, obviously based on, like you noted before, on owner reports, as opposed to like actual, potentially, veterinary diagnostics. But we at least have some baseline data in those sports, but a lot of sports, we don't have any information on what the most common injuries are. And so kind of getting familiar with at least physical demands might give you an idea of what kind of injuries to expect. But I think that's where we really need a lot more research.
Are there any papers that you recommend that vet rehabbers should look at, particularly about the sporting dogs?
So obviously, a lot of sports, we don't have the research, but there was, for flyball, there were a couple of studies on like the surveys for the injuries in flyball dogs. The one paper was in Frontiers, and I can link that one. And then there was the one paper on like retrospective survey for canicross injuries. And then for agility, there are quite a few more retrospective surveys. And so our group has published, we've got 3 of, papers on like injuries in agility dogs, with more coming out. Dr. Deb Sellen has the cruciate paper and the digit injury paper. There have been a couple that have come out outside of the US. So there were 2 Finnish agility survey papers that came out at the beginning of this year, and then one that just came out this week from I think Sweden, that talked about like what kind of research like owners want to see, like agility dog handlers want to see. And so those are the kind of big injury type papers. And then if you want to get into the like nitty gritty of like biomechanics, I think the 2 best papers for agility, like, biomechanics, are Katja Sonnell's papers. She did like limb dynamics paper for single like straight line jumping and then jump turns. And that gets super into like super complex data that, there are a lot of math equations that you like look at the paper and you're like, oh my gosh, like I don't understand that. But it's really actually interesting and valuable information on kind of the forces on the body for dogs that are jumping.
Yeah, so awesome. So I think we'll try and put that all together in a document for everyone that you'll be able to access all the links to all that research. Thank you for that. So if we could summarize.
And we actually, I was going to say, actually, for the agility dog research, our Agility Dog Health Network has put together a full list of any agility related research. And so that some of it's agility specific and some of it is like we have kind of a behavior section and some kind of general health sections. And so we have a whole list of all of that research. That does not include the like flyball or canicross or sled dog or racing greyhound literature though.
So tell us about that group and why you created it.
Yeah, so, one of the biggest, issues with, sports dog research or any sort of research is having access to a patient population that's big enough to have, kind of statistical effect, as well as, the issue with funding and grant funding. And so kind of the idea was to put together kind of a group of researchers that have different kind of areas of like niche areas of research and knowledge, and then try to put this group together to kind of create new research projects, be able to use the kind of power of the group to apply for funding, and also to limit some of the issues where we're so spread out that everybody's doing like little projects on their own, but nobody's talking to each other. And could we be collaborating and actually, instead of overlapping and doing a lot of the same research, pushing forward and doing research together. And so currently the group has researchers from Washington State, University of California, Davis, Minnesota, and then University of Florida, and then us at Ohio State. And the plan is to kind of expand that and potentially, make it an international group as well. But we're still trying to kind of figure out logistics of the group and applying for funding. And we actually have our first kind of group paper that we're going to be submitting for publication here soon. And then we've applied for a couple of grants as a group. So that's kind of the idea. And hopefully that'll continue to grow and be able to kind of advance the sports medicine research a little bit faster, having multiple people working together.
Yeah, I love it. I love that you're collaborating. So we'll put a link in the description for more information about that group. So yeah, maybe we can get some international people to join your group. That'll be great. So Arielle, to summarize, I just thought, some of the things that maybe the vet rehabbers would want to know from all the research that you've looked into. Can you summarize for us maybe the two main ones? So flyball and agility. What are the most common injuries that they probably would see looking at the research that has been done?
Yeah, so for agility dogs, the three most injured locations are shoulder, iliopsoas, and then low back. For shoulder injuries, the most common injuries were bicep tendinopathies, supraspinatus tendinopathies, and then medial shoulder instability. For iliopsoas, the most common injury was a strain. And then low back, a lot of dogs were reported to have like lumbosacral type injuries. So lumbosacral stenosis, lumbosacral disease, and or vertebral disc disease in that location. And, cruciate injuries weren't as common as I think a lot of people think they are. Obviously, when you have them, they're, fairly impactful, but out of the total number of injuries, they weren't a huge number. And then for flyball dogs, wrist and digit and shoulder injuries were pretty common.
So another thing that I remember from practice, like agility owners coming in, and then like the dog will have like a subtle lameness, and then when I examined it, like I couldn't find anything painful. It wasn't lame at the time, so it was like an intermittent lameness. But then like the owner would say things like, and I remember once I had this, that the dog was like not as quick through the weave poles, and I found a few of these sort of things that owners would say. So I wondered if I could go through them and then you could give us an idea of what we should be looking for. So that exact one, dog going slowly through the weave poles, what could that be?
So the weave poles are often a shoulder issue. I would say, and this is honestly, this is where we don't really have the research to support this. And so this is just based on, clinical experience. And honestly, we don't even have any sort of biomechanics research to say like, these are the biggest forces on the body through the weaves. But if you think about like how dogs go through the weaves, and that, significant like abduction that they get through the weave poles, any sort of shoulder, type issue is going to, cause chain either like slowing through the weave poles, or they pop out of the weave poles early, or, they change their weave pole gait style. So maybe they were like a single stepper, so like single footing through the weaves, and now they're kind of double footing. So shoulder, would be one of the things that I think of a lot for that. But obviously, like looking at kind of that whole chain of the body through the weave poles, there's a lot of side bending of the back. So, ruling out any sort of, back pain or, intervertebral disc issues, they have to, push with those back legs. And so, ruling out kind of those iliopsoas injuries. I don't see those as commonly reported through like with weave issues, but it would be something to, keep in the back of your mind.
Thank you for that. So I've got another one, knocking the bars.
Yeah. So knocking the bars, typically they knock their bars with the back feet or the back legs. And so any sort of jumping issue, I always want to rule out anything kind of in that back chain. And so, low back, so like lumbosacral issues, because a lot of times in order to clear the bar, they have to, extend that lumbosacral space. And so if they start to extend to get over that bar and it hurts, they'll often kind of pull their back feet up underneath them and knock that bar because it hurts to get over that bar. And so lumbosacral issues, obviously any sort of hip issues, iliopsoas injuries, because they have to, extend those back legs to push off to get over the bar. And so if they have iliopsoas pain, a lot of times that will be uncomfortable. And so they'll knock the bars, when they have any sort of issues like that. Obviously, cruciate tears, I would expect to have more issues than just knocking bars, but any sort of things in the pelvic limb.
Yeah, and all those things you discussed now would probably double up the same if they were stopping or refusing or running out of any of the jumps. Thank you so much. Like I remember thinking, there is quite a lot of research in sporting dogs, and I think, you've really put it into perspective now that we actually don't have that much. And, that those surveys, we have such limitations with them. So I'm really excited that you and your group have got together and are busy trying to get more research for us. So we thank you for that. And thank you so much for sharing all your knowledge. And I look forward to following you and everything that you guys are doing to advance the field of sports medicine.
Yeah, well, thank you for having me. And then I'm also doing, a series of lectures for you guys on like biomechanics and agility dogs. And, kind of one of the goals for that is kind of what we talked about is, understanding the demands of the sport and, kind of the issues that we see pop up in the agility dogs, how they might present, the types of injuries, and how they're related to those physical demands. So we'll get into kind of the nitty gritty in some of those lectures.
Yeah, we're looking forward to it. There are 4 lectures. Later on in the year, it's going to be great.
Yeah, I'm pretty sure like as I've created the slides, there are more and more slides. I'm like, I'm pretty sure this could be like a series of 10, but I'll condense it into 4.
Well, there's always next year, so we can always have more and more lectures. So that's awesome. Thank you so much, Arielle.
Yeah, thanks for having me.
Take care. Bye-bye.
Bye.
If you enjoyed this podcast, please hit the subscribe button so you get notified every time I load a new podcast. And please, if you get a moment, head over to Stitcher or iTunes and leave me a review. It's a really lonely job being a podcaster, and so the only time I get to hear from you or know that you're out there is when I get a review. And know that I read every single one of your reviews. So to those of you that have left reviews, I want to say a very, very big thank you. Every time we get a review, it really helps to get the Veterinary Rehabilitation Podcast out there to all the vet rehabbers all over the world. All right, vet rehabbers, so if you are looking for more continuing education in the field of veterinary rehabilitation, head over to Onlinepethealth.com. Go be awesome, guys.